Hello beautiful people, and welcome back to my channel. Today's video I am going to be sharing with you my second trimester recap. So I try to do these every trimester. Oh, so I'm officially in my third trimester. There's like differing opinions, I guess, on when that starts. Some people say 27 weeks, some people say 28 weeks. Either way, I'm over 28 weeks now. So I'm going to be sharing with you guys my second trimester and what all I experienced and how all that went. So right off the top, I had, if you guys remember in my first trimester recap, I said that I was unable to eat meat, unable to eat onions, unable to eat garlic, or anything seasoned with those things, and that is still the case, sadly. So I am not able to eat any meat. So once again, it's been kind of trying to figure out like what to eat and like how to get in vitamins and nutrients. And as a result of that, I was diagnosed with anemia. So I am currently on a iron supplement. I also had my thyroid retested, which if you guys remember at the like very beginning of my pregnancy, I had my thyroid tested and my levels were elevated, and this time they were on the low end. So my thyroid decided to go whoop, which I'm thankful for, because I was feeling a little, when my thyroid was high, I was feeling pretty awful. I mean, I definitely haven't been feeling great either with, you know, the anemia and with the lower thyroid levels, because both of those things tend to make you very fatigued and lethargic. On top of already being fatigued and tired and lethargic just from being pregnant. So that's been challenging, but I am feeling like 20% better than I was a few months ago, or not a few months ago, a couple of months ago, not even a couple, what am I even trying to say, several weeks ago. I also recently started to get SPD, so towards the end of my second trimester. If you don't know what that is, it's basically symphysis pubis dysfunction, where so when you're pregnant, you guys probably already know this, most of you, when you're pregnant, your pelvic bones actually soften because of the hormones in your body, and just like the weight and the pressure from the baby, or babies in my case, it causes a lot of pain and pressure and discomfort in your pelvic region. And they also call it like girdle pain. So for me, it kind of just feels like my pelvis is like trying to split open, which sounds horrific, and it is very painful. But they do have like contraptions, like a belly band or a V-sling. I've been using my belly band and it does help, but just being on your feet a lot, which is not really recommended for me anyway, because I am pregnant with twins. They want me to rest and be chill and laying down as much as I possibly can. But, you know, if you have kids, especially toddlers, you know that that's not always possible. And it's the holiday season, so I've been super busy trying to get all of the things done. So I have been in a lot of pain recently, which super sucks, but it is what it is. There's not anything I can do about it. And then of course, you know, just having like Braxton Hicks contractions. I've been having those pretty frequently. Sometimes they last all day long. They always get more intense in the evening, which I learned recently is due to an influx of hormones in the evening. So if you are pregnant and you're experiencing that later in the day, that's probably, let me turn my phone off. That's probably why you're experiencing the pain, Braxton Hicks, later in the day. Also, of course, you know, if you're actually having real contractions, they are intense, they're painful, they're hard to talk through, hard to breathe through. So I'm not really having that, thankfully. But the Braxton Hicks, they are pretty rough. Luckily, and I'm gonna knock on wood because I feel like the last time I said this, it ended up happening like right after. But I have not had morning sickness, like throwing up morning sickness, in weeks. Thank you, Lord Jesus, because that was like super trying and super wore on my mental health. I still have like nausea occasionally, and I still have lots of aversions to foods and smells and just all of that stuff, but I'm thankfully not vomiting anymore, which is like such a huge relief. Oh my gosh, it's such a huge relief. Also, in the last 2 or 3 weeks, if I'm on my feet for a period, like a long period of time, like a pretty long period of time, I am starting to get a little bit of swelling, which is very normal. You can retain fluid when you're pregnant. They're not super concerned about it just because it's not like happening for no good reason. Like it always seems to happen like when I've been on my feet for a while. Another thing is that I would have had my glucose test, but I personally chose to like forego it, which is an option. Definitely do your own research when it comes to that and your pregnancy, but I just decided that I did not want to take the test this pregnancy, and that I was just going to test my sugars at home. I did have gestational diabetes my first pregnancy, so I'd already had all of the equipment that I needed to be able to do that, so that might not be like realistic for everyone, but you do have lots of options, so definitely weigh your options and do your own research. But I tested my sugars at home, and even though they're not diagnosing me with gestational diabetes, they still want me to continue to test my sugars. Luckily, I only have to test them twice a day, so fasting and then after one of my meals. I can pick whichever one because my numbers have been good, but just because I am high risk, I've had gestational diabetes in the past, and I am pregnant with twins, they just want me to keep testing it. So I don't know why, but I'm gonna keep doing it because safety first. As far as the babies go, they are measuring right on track. So the last time I went to the doctor, they were both around 2 pounds, I think it was, and both measuring at 26 weeks at that time that I was, which is good. They always measure their fluid, and there was just a small amount of extra fluid, and it's not anything to worry about. The doctor said we're not concerned about it right now at all. Babies are measuring right on track, so no worries there. And also, I learned that baby B has an offset umbilical cord to her placenta. So typically with a placenta, the umbilical cord is like centered into the placenta, and that's where they draw their nutrients, and that's how they grow and thrive. But hers is off-centered, and I was a little bit concerned about that because I read it in my chart and didn't get told that by my doctor. But after speaking to my maternal fetal medicine doctor, which is the specialist that deals with high-risk pregnancies, because I'm pregnant with twins, she said the baby is thriving and growing, so we are not concerned at all in the least that that's off-centered. So as long as the baby is growing and they're getting what they need, that's all that they care about. So on that note, I switched OBs. I know that sounds kind of crazy. I think I was 22 weeks when I switched, but I just had a series of events over the course of the first part of my pregnancy that was just like red flag, red flag, red flag. The last incident, saw one of the doctors at the practice, and I was passing a kidney stone. I didn't even want to go into the office that day, but the nurse insisted that I come in. I was in unbearable pain. I was crying. I really just wanted them to prescribe me a antibiotic because I had been trying to pass that kidney stone for freaking weeks. So if you guys follow me on Instagram, or I may have mentioned in my last video, I can't remember if I was going through that at that time. I passed the kidney stone, and then literally like a week later, I started passing another one, but that one was so big, it took me like 3 weeks, 2 or 3 weeks to pass it, which is crazy. It's never taken me that long to pass a stone, at least not to my knowledge or my remembrance. So I just wanted him to prescribe me an antibiotic because I felt like I had potentially had an infection, maybe just based on the experiences that I had had in the past and some of my symptoms. And I just wanted him to call me in Microbid, which is a urinary tract antibiotic, which they had prescribed to me when I had my previous kidney stone. So I didn't understand what the big deal is, but no, they wanted me to come in. I went in, and the doctor literally said to me, "This is gonna sound rude, but what do you want from me?" So I was like, I didn't even want to come in here. You guys made me come in here. I said, I just want an antibiotic. Is that too much to ask? Like, and if you have to say, I know this is going to sound rude, just don't even say it, especially a doctor. Like, that is horrible bedside manner. So that was the final straw for me. I switched doctors, I switched practices, and I am super happy at the practice that I'm at now. The doctor that I have, she is super great. Like, she's an older doctor, so she gets right to the point, but she actually took the time in the office with me the first time I saw her, and I had no doctor at the other practice do that. Like, they're trying to get me in and out in 5 minutes, whereas I sat in there and talked to her for probably 20. I feel like she really knows her stuff. Like, she might not be, you know, bubbly and have like this big personality, but she knows what she's doing, and she made me feel super comfortable, and I didn't feel like I was bothering her, and I didn't feel rushed at all. So I'm very happy that I switched. So I highly recommend, if you are going through a situation, whether you're pregnant or not, at your doctor's office, it is never too late to switch practices. Do not feel like you are obligated to them. Do not feel like you owe them anything. You always have to advocate for your own health and find a new doctor. So as far as other symptoms go, let's see. I have started having headaches again, randomly. They're not every day. Just, you know, overall tiredness, fatigue, pain, all the horrible things of pregnancy. Because basically, if you've ever been pregnant before, just think like when you're in your 3rd trimester, kind of like how things are starting to kind of get really difficult. That's kind of how it was for me and is for me through the last part of my 2nd trimester into the early part of my 3rd trimester, because I'm basically full term as far as like my belly goes. I'll show you guys my bump in a second. But I have 2 like 2.5 pound babies in there. So that's like what, 5 pounds? So that's like almost 1 full term baby, almost, you know. So it's getting rough. Definitely keep me in your thoughts and prayers, because I definitely need it. But I also need these babies to bake a little bit longer, at least. I mean, I'm definitely hoping to go to my induction date, at least. And I still have no birth plan. I don't know if I'm going to have a C-section. I don't know if I'm going to try for a vaginal birth. I'm just kind of winging it right now. I don't know what position the babies are in. The last time I had them checked, baby A was head down, all the way down into that area, and baby B was transverse. But I feel like now, based on like the kicks and stuff, I feel like they're both head down. So I'm not really sure. I'll find out. In a few weeks, I think I go back to the MFM, because they're the ones that always do the ultrasounds to check on the babies. So I'll find out then. So right now, all of that's up in the air, but I definitely want these babies to keep baking for at least 8 more weeks, I guess. 36, 37 weeks is, I guess, what they consider, which, I don't know, it just depends. But 38 weeks is full term for twins, so they won't let me go past that. Everything else is up in the air. So you guys keep me in your thoughts and prayers, please. But I think that's everything. I'm trying to remember if I have any other symptoms or... No, I really can't think of anything else. I mean, I'm just scooting on by every day, trying to make the best. Taking all my vitamins, my supplements, trying to eat as well as I can. Yeah, that's pretty much it. So I'm going to go ahead and close out this video. Otherwise, I'll just sit here and ramble and ramble and ramble for hours and hours. I'm just kidding. But if you guys have any questions, of course, leave them in the comment section down below. I would love to answer those for you guys. My next update, I don't know when I'll do my 3rd trimester update. I definitely, like, if I make it to my induction date, I'll try to do it, you know, a couple weeks before that. And I also want to share with you guys, like, what I pack in my hospital bag for me and the girls, which I will be doing in the next, like, week or so, probably. But I hope you guys enjoyed this video. If you did, make sure you give it a big thumbs up. Subscribe if you haven't already. And thanks for being my kind of weird. Bye!